Hi, I'm Louise. I'm here with Beyond the Room at the International Forum for Quality and Safety in Healthcare. I'm really excited about this next interview because I feel like we have a lot in common, so I'm really excited. Do you want to introduce yourself?
Yeah, so my name's Agnes and I work for COMIC, which is part of the Leeds and York NHS Trust, and we specialise in child adolescent mental health, and we do like mental health research specialising in like co-production and involving like young people.
So how did you get into that in the first place?
Well, I did, if we're going way back, I did psychology at university, and then I absolutely loved doing my like research and things like that, my dissertation, and then I came across the patient and public engagement ambassador role, and that was in the COMIC team, and then I luckily got that, and a large part of that was setting up the Young People's Advisory Network, which is how we co-produce our work. And I absolutely loved it. I loved doing the outreach, and I loved meeting the community groups and like the way that we like co-produce all of our research. And then luckily I've fallen into an RA role, so a research assistant role within the team, and I've just stayed on like helping run the network and like co-producing research basically.
No, I love that because I've set up some youth advisory boards and youth groups before, so it's such an exciting process. What was your favourite thing about that process in terms of setting up and meeting the young people?
I think a lot of my expectations like weren't met in like a really great way. So we went in with it basically originally wanting to create a group. So it was going to be a group of about like 10 young people. And then when we spoke to young people in the community, they were like, we don't want one group. Like they were like, there's already a million groups out there, and we're in community groups that make us feel like safe and heard, and we want you to like work with us in these settings where we're already doing a lot of the work that you want to do. So we essentially then were like, okay, let's get rid of the group idea, and we created a network which is currently around 9 different groups that we go to and we like connect with. And I think having the ability to like learn from them and like break down so many barriers that I had personally or they have, it's incredible.
Okay. So in terms of like actual output and the co-production piece, what are some of the kind of innovative and creative ideas the young people were coming up with?
So one of the studies that's just finished, I wasn't working on it personally, but it was a study co-producing ADHD interventions. And what it did was working with families and young people who have diagnosed ADHD and some who were suspected ADHD. And it was looking at how we could use nature and green and blue spaces to like support their symptoms. And some of the ideas that they had were ones that we already had, so like just getting outdoors and making sure that they had like stimulation regularly, but also things like finding ways to bring nature indoors. So a lot of like communities don't have access to a lot of green and blue spaces. So we had loads of really interesting talks, especially with parents, about how we can learn to bring nature indoors and give children like the same stimulation and the same education in that way, but indoors. And it was like fascinating to learn like, I guess like their experiences with what barriers are preventing them from accessing nature and things like that, but also how we can provide toolkits to encourage young people to access like green and blue space inside.
Brilliant. So what do you think is like the future of the project then, and the future of actual co-production?
Well, I guess co-production itself, I guess it's become a bit of a buzzword, I think. So it's definitely like something that's growing within research. And I think that's amazing, but I definitely think there's still barriers in the sense that I think people are using it as a bit of a tick box. So saying that we've co-produced things when actually they haven't done it properly. So I think there's definitely like a lot of steps to be taken. And I think the next stage is to make sure that co-production is actively involving young people, so making sure that young people have a real say and influence over what studies are being done. And I think that needs to be done by involving them from like study development and idea development all the way to dissemination. So I think really like the idea of co-production has got to change, and people have got to understand that actually it's about having young people have a voice and making sure that they're actually influencing change that they want to see.
Yeah, amazing. Thank you so much.
Oh no, thank you so much.
Thank you. Yeah, that was great.